As hospitalizations for COVID-19 continue to rise, the chief clinical officer of Trinity Health of New England is encouraging people to take protective measures once again as the country battles another surge of the virus.
Here in Massachusetts, more than 27,000 new cases were reported on January 5th and a 7-day positivity rate of 22% and more than 2,400 hospitalizations.
Right now, we see a high community transmission of COVID-19 across this region, across this nation.
Dr. Syed Hussein, the chief clinical officer of Trinity Health New England, says that's a sign that masking and social distancing need to be brought back, at least for the next few weeks. Dr. Hussein tells Western Mass News there are more than 200 hospitalizations due to COVID-19 at Trinity Health, and that more than half of those patients are unvaccinated.
If you look at who's getting hospitalized, more than 65% of our patients that require inpatient admission for COVID-19 are unvaccinated. And unfortunately, those individuals tend to have poorer outcomes.
Dr. Hussein says they tend to be milder in nature, and he says healthcare officials are now paying closer attention to hospitalizations.
Our hospitalizations across Connecticut and Western Massachusetts are ticking higher than what we experienced, or I should say closer to what we experienced in the first surge in April 2020.
So what about flu-rona? A new term circulating the web is when someone has the flu and COVID-19 at the same time. Dr. Hussein says it's best not to panic and that this can be treated.
We have many more tools in our toolbox to better manage this condition.
And the question foremost in many of our minds, will this pandemic end?
The threat of new variants popping up will always remain till the world collectively gets to a stage where a large chunk of our global population has been vaccinated.
Dr. Hussein also stressing the importance of getting a booster shot. He says once you get boosted, it holds up pretty well against the Omicron variant, which the CDC says now accounts for 95% of all COVID cases here in the U.S.